Okay, folks. Today's topic A is to help those people with long term or with long COVID. Okay, this this discussion deals with how patients, how people that have long COVID are being treated in medical facilities. Okay, so we're going to go through that for A. So please join me in today's discussion A. Okay, here we go. The article discusses the struggles of long COVID patients in getting medical professionals to acknowledge their condition. A study involving interviews with COVID or a study involving interviews with with 14 individuals with long COVID revealed that many feel dismissed or disbelieved by doctors, leading to a loss of trust in healthcare systems, social circles, and even their own bodies. Some patients reject psychological support because they fear it implies their illness is purely psychological rather than medical. The researchers emphasize the importance of offering psychological care alongside medical treatments in a way that does not feel dismissive. Give me 1 second, please, guys. Slow down. Would you like to explore related studies on long COVID and healthcare approaches? Certainly, long COVID patients face a range of challenges, including medical dismissal. Many report feeling dismissed or disbelief by healthcare providers, leading to a breakdown in trust, reluctance to seek further medical care, to psychological stigma. Some patients avoid psychological support because they fear it will undermine the legitimacy of their medical condition, reinforcing the misconception that their symptoms are purely psychological. 3. Social isolation. The lack of recognition from both medical professionals and social circles can result in emotional distress and withdrawal from community interactions. Give me 1 second. Center straight. Okay, unclear treatment pathways. Since long COVID is still not fully understood, patients struggle with limited treatment options and often face trial and error approaches to symptom management. These challenges highlight the need for integrated healthcare solutions that validate patients' experiences while offering both medical and psychological support. Would you like to explore potential interventions or emerging research on long COVID care? There are several promising interventions for managing long COVID. The research is still evolving. Here are some approaches that have shown effectiveness. Okay, physical rehabilitation. Supervised exercise programs, including gated physical activity and pulmonary rehabilitation, can help improve fatigue and respiratory symptoms. Cognitive behavior therapy. Online CBT programs have been found to reduce fatigue and improve concentration in long COVID patients. 3. Dietary adjustments. Some studies suggest that anti-inflammatory diets and specific nutritional interventions may help alleviate symptoms. 4. Mental health support. Integrated physical and mental health rehabilitation programs have shown benefits in reducing depression and improving overall well-being. Okay. Let's see. Medical devices and technologies. Emerging technologies such as neurostimulation and wearable health monitors are being explored for symptom management. 6. Multi components rehabilitation. Combining physical therapy, psychological support, and lifestyle modification appears to be the most effective approach. Would you like to explore specific interventions tailored to cognitive symptoms or fatigue management? Long COVID interventions differ from traditional treatments in several key ways. 1. Multi-component rehabilitation versus symptom-specific care. Traditional treatments often focus on managing individual symptoms. E.g., prescribing pain relievers for headaches or antidepressants for mood disturbances. In contrast, long COVID interventions emphasize multi-component rehabilitation, combining physical therapy, cognitive behavior therapy, and dietary adjustments for a more holistic approach. 2. Emerging technologies versus conventional medicine or medications. Traditional treatments rely on established medications, while long COVID care is exploring wearable health monitors, neurostimulation, and adaptive rehabilitation programs to address lingering symptoms. Okay, guys. Personalized therapy versus standard protocols. Long COVID interventions increasingly focus on tailored treatment plans, recognizing that symptoms vary widely among patients. Traditional approaches often follow standardized protocols that may not fully address the complexity of long COVID. 4. Psychological intervention integration versus medical only focus. Unlike conventional treatments that primarily address physical symptoms, long COVID interventions integrate mental health support, acknowledging the psychological toll of the condition. Okay, here's the question for y'all. Would you like to explore specific interventions tailored to cognitive symptoms? Give me a second. Or fatigue traditional treatments for long COVID with both risk and benefits, depending on the approach. Benefits: symptom management, conventional medications such as pain relievers, anti-inflammatory drugs, and antidepressants can help alleviate specific symptoms like fatigue, brain fog, and joint pain. Established protocols. Many traditional treatments have been tested over time, providing a structured approach to managing post-viral conditions. Okay, accessibility. Standard treatments are widely available and covered by most healthcare systems, making them easier to access. Okay, risk, limited effectiveness. Some traditional treatments focus on symptom relief rather than addressing the underlying causes of long COVID, leading to incomplete recovery. Side effects: medication like steroids and antidepressants have adverse effects, including dependency risks and long-term health complications, lack of personalization. Standardized protocols may not fully address the adverse symptoms of long COVID, requiring more tailored approach. Would you like to explore alternative emerging treatments that might offer a more comprehensive approach? Okay, management. Traditional treatments for long COVID focus on symptom management rather than addressing the underlying causes. Some common approaches include pain relievers and anti-inflammatories. Okay, drugs. Medications like NSAIDs and corticosteroids are used to manage joint pain and inflammation. Selective serotonin reuptake inhibitors or SSRIs. These antidepressants have been explored for treating brain fog and fatigue. Low dose naltrexone, originally used for opioid dependence. This medication has shown promise in reducing inflammation and improving cognitive symptoms. Give me 2 seconds. See where these are stopped. Okay. Pulmonary rehabilitation for patients experiencing respiratory issues. Structured breathing exercises and therapy can help restore lung function. Physical therapy, gradual exercise programs help rebuild stamina and reduce post external malaise. Would you like to explore how these compare to emerging treatments? Okay, guys, so that is A for you. Give me a little bit, and then I'll have B on shortly for you. I'm gonna go take a little break and grab a drink, and I'll be back with you shortly. For now, Gator Wellness, take care, folks.